take it away.
Will do. Okay, thank you, Russ. Good morning, everyone, or afternoon for those on the East Coast. So today we will have an informal discussion, like Russ said, on the adaptation, fidelity, and tailoring related presentations from this year's D&I conference. So the agenda today is just going to provide a few updates of where we're going to be in 2024, and then we'll move into the discussion. And then, just like Russ said, we have a list of the AFT-related presentations in the chat, but the link is also in the email I had sent out. So for our next coming meetings, we're really excited for this year's lineup, and we are still looking for some presentations throughout the rest of 2024, but we wanted to share with you the presentations that we have currently booked. So January 8th, we will hear from Dr. Erin Cruz-Dyer on using the practical, robust implementation and sustainability model, or PRISM, to identify implementation determinants of a statewide diabetes learning collaborative in Kentucky. Dr. Cruz-Dyer also presented this at the D&I conference, so if you're able to attend, it'll kind of be an expansion on that presentation. For our February meeting, we will hear from Dr. Prajakta Adzul on one of the recent chapters in the D&I textbook that they co-wrote with Dr. Rachel Shelton on fidelity and its relationship to effectiveness, adaptation, and implementation. And then in April, we will hear from Dr. Dave Bueller on adaptation of an evidence-based occupational sun safety program for underserved outdoor workers in Southwest Georgia. They also presented this at the D&I conference. So again, it'll be an expansion on that. It seems like, based off of our conversations with them, that they've actually expanded this work a bit. And so it'll be really nice to hear some updates on this project. And you can access all of the upcoming D&I meeting, or the AFT meetings. You can register for them at the link below. I'm just going to put it into the chat for y'all. And so you'll be able to select from a list of different AFT meetings, including those we haven't booked yet. But if you are interested in any of these, feel free to register. And then just as a reminder, we do have some open slots for the remaining months of 2024. So if there was a presentation that you saw at D&I that you found interesting, or if you have a project coming up or a project that you're currently working on that you would like to share, we would be more than happy to hear from you. We also encourage any works in progress that you would like any feedback on. So please fill out the nomination form here, and then I will also put it into the chat. And then we can reach out to you to see what month works best. And then, as always, if you have any questions, please reach out to us at the DISC email. And with that, I will hand it over to Russ.
Okay. Thank you. Again, it's great to see a reasonable number of you do use chat a lot. And Kara, could you help me monitor chat as we're going along, and feel free to chime in there. I will say I noticed Dr. Netta has joined us. And if you would, in chat, I'm sure Gila and her colleagues that put together the agenda would love to hear if you have just general thoughts or recommendations about the meeting too. Feel free to put those into chat. We won't have a chance to directly go over all of those, but I'm sure she would appreciate it. And I'd like to start off by doing something a little different here, and that is using the function under reactions at the bottom of Zoom about raise your hand, just so I know where we're at here. could you put that, hit that button and then keep that up if you would? What I'd like to do is just see how many people we have so I can kind of monitor the chat. Put it up if you went to the meeting is what I'd like you to do. If you were at the D&I meeting, please put your hand up and then keep it raised. What I think I'm going to do is just go around the group in the order that you appear on my screen. And what I'd like to do is just have one point. We'll need to be brief, and then we can come back and expand in detail. But if you could just briefly kind of summarize either a theme or a particular session. I think most of us have up, or I encourage you to if you don't, that nice document that Kara prepared for us. And you can click on those links, go in to find out a little bit more. If somebody's talking about a session, you can go in there and look at it too, even if you weren't at the meeting, to benefit from the discussion and things. With that, I'm going to just go ahead and call on people in order. So again, just briefly, what stood out to you most about the meeting, and was there a particular session that you thought was really good? And Reed Parks is the first hand that I see there. So Reed.
Hi, Russ. I had a lot of great conversations between sessions about how AI, machine learning, and other automation tools can help us with tailoring or help us understand when adaptations are made.
Well, super. That's great. Did you see sessions on there? I was kind of looking and didn't see many actual sessions on AI, Reed. I might have just missed them, but did you see a lot of actual sessions, or were these just the kind of side discussions?
Discussions on the side generally. There were a few posters and other things that sparked conversation, but mostly in between.
Okay. Well, that was, we can maybe come back to that. I'll make a note, but that was one of the things, again, I kind of expected and might be interesting to see more in future meetings. And we may circle back. I'm making a note about topics that would be fun to talk about and how that can be used to inform adaptations. But thank you. Good modeling, nice and succinct. Kelly, I have you next.
Hi, everyone. I'm Kelly Ashbetter. I'm a faculty member at Dartmouth, and I co-direct the Dartmouth Center for Implementation Science, and I also lead a methods unit in the Implementation Science Center for Cancer Control Equity that's led by Karen Emmons at Harvard. I attended the pre-conference workshop that Shannon Wiltsey Sturman, Anna Bauman, and J.D. Smith gave on, it's really about adaptations, documenting, analyzing adaptations, and thinking of using frame and thinking about how, whether and how adaptations were made to address health equity. And it was a really useful workshop. I think two points that I thought were really useful for my own work. One was, I've never actually heard Shannon Wiltsey Sturman herself talk about how she thinks about frame and how she thinks why you document the process, why you document the reasons, why you do it for adaptations that are made to individuals, but then also to an entire intervention program and how those can be different. But I wanted to say for this group, the one of the most useful aspects of that workshop was the last 20 minutes when J.D. Smith started talking about how approaches to study design and actually analyzing the data. So there's a lot of focus on documentation and tracking, but I know from my own work, it's really challenging to find examples and to make decisions about analysis when you're interested in evaluating adaptations. And so he had some useful thoughts about that. And I'd love to have a workshop or some time with JD to start talking about actual analysis and how we think about that. So it's really good. Thanks.
Great. Thank you. That was super. Two quick follow-ups or thoughts. One, for those of you that were there, if you might put in chat, if you went to a pre-conference, that would be interested to hear how you thought about one of those workshops. I know Gila would appreciate feedback on that. And if you thought those were worthwhile, if you'd like to see more of those or not, would be helpful. And then just a quick probe, Kelly. Again, if we have time, we can come back to that. But in terms of what JD did, I'm wondering if he was thinking about, I know there's this interface between implementation strategies, which are adaptations and things. If he was like focusing on using lists to do that or not, that was separate.
No, we were really focused on intervention adaptation, and he was
Okay.
talking about, I mean, yeah, no, so he didn't get to lists.
Got it. Okay. Thank you very much. Amir, I have you next.
Hello, Dr. Glasgow. Hello, everyone. My name is Amir Azizian. I'm joining from Saskatoon, Saskatchewan, Canada. I'm a learning health system specialist working at the Saskatchewan Health Authority. And I joined to the conference for the first time. So I was a new, new first timer to the conference. It was very informative and instructive. I learned a lot during the sessions. So I was going to put in the chat, I attended the Building Effective and Equitable Implementation Research Collaborations with Community Partners workshop that was hosted by Dr. Moore, who is here, and Dr. Khan, and Dr. Caballero. I really enjoyed the conversation and understanding the impact of using various implementation methods and theories and models and frameworks in addressing equity and disparities in different settings. So that was a kind of a new concept for me, and I benefited a lot from that. And that led me to attend some sessions that were tailored to address equity in implementation efforts. Also, I attended the sessions that were related to policy and the impact of policy on equity. So I attended a couple of sessions that were hosted by Dr. Erika Krabel. I really enjoyed the coffee chats because they were kind of informal and kind of smaller groups. So I benefited from those sessions as well. But overall, very instructive and very informative conference for me. Thank you, Dr.
Great.
Glasgow.
It was super seeing you. I was delighted to see the number of people for whom it was their first meeting thing. So I'm glad you were able to attend there. That was great. In particular, I noted we did have more representation for international representation, including a few people from low and middle income countries and things. So I thought that was really great. And of course, you noticed that some of the keynotes, were from the UK anyway there. So that was great. Did you notice much, since Amir, your expertise is learning health systems, did you see much on learning health systems in terms of the actual presentations and things?
I saw some posters that were touching on the concept of learning health systems. Obviously, the focus of the conference was more on dissemination and implementation science, but I was able to find the connections between these two fields.
Yeah, great. Great. Okay, thank you. Lydia.
Hi, good morning, everyone. It was my first meeting too. I had the pleasure to meet you in person, Russell, and also Kelly. We attended together the adaptation pre-conference workshop. It was super great. I also loved the coffees with special note for the Erika Krebel, the health policy one, the global IS, and the equity in the NI. And I think at the end, I don't know if you remember, Kelly, if you can help me. I think at the end of the pre-conference workshop, JD Smith talked a little bit about machine learning and the tracking of adaptations. He said that I don't know if I'm correct, but that there's some useful things, but we always have to check again, validate their work. I don't know if I remember correctly, but that was it. Really liked it, the experience.
Super. Well, it's great, and I appreciate comments too, just about networking, that you and Kelly need to do things. That's really one of the most important things, I think, and often the most useful things about the meetings, as much the outside connections as the formal sessions and that sort of thing. So particularly nice that the coffee that you found, that was good. I'm not able to keep up with all of the chat, but please do keep, entering and have conversations among yourself about that. I do note that, just a quick aside, that there was a question from Patricia there about policy issues and things. And I'm wondering, did anybody, just to go a little out of order, to be free from, did anybody see sessions on policy implementation? Just
Yeah.
go ahead and jump up if you did.
Hey, Russ. So I was involved in a couple of those.
Okay.
Most of these were led by Erica Crable, our up and
Mhm.
coming amazing policy advocate at UCSD and our Dissemination Implementation Science Center. There was a coffee chat around health policy with Erica Crable and Natalie Riva that I wasn't able to attend, but I heard it went really well. And it was interesting because it was very different perspectives from Erica and Natalie.
Yeah.
Then there was a symposium illustrating some projects funded by NIDA in the state of Oregon. One is which I'm the PI on, but Erica is leading our policy work, engaging policy actors to co-create sustainment strategies for motivational interviewing and an artificial intelligence platform we're working with organizations to implement in the state. So we're working with organizations and also with managed care organizations, the Oregon Health Authority, and their Alcohol Drug Policy Commission to co-create, co-design, which I think our concern is it's hard to get that done in a 5-year grant. So we're making inroads. And then Gracelyn Cruden, whose project is one of the HEAL data to action projects, working with the state to essentially create the data that's needed to inform policy action around Measure 110, which is a decriminalization measure within the state. And then our colleagues, Dr. Rabajin and her colleague, looking at implementation and working with policy in the state of Tennessee. The other one was with a Norwegian colleague that Erica's working with on using system science and causal loop diagramming and actually trying to test system dynamic models around implementation strategies and engaging policy in that process. So there was a good representation. I will say the sessions were very full around policy.
Yeah. That is super. And as you well know, being leading that, it's great to see that. It hasn't had as much tension over the years and things. But I love both of those themes, particularly the co-creation around sustainment, and it ties in with the AI thing. And then this notion about using systems dynamic modeling is very cool. Would be great if we have the time to talk about it today, but maybe even more so. Those are such great and full topics. Maybe you and colleagues are willing, we could have a session later in the year on that, one of these sessions. So thank you for that. Let's see. Next, I have Deborah Moon.
Hello, everyone. Can you hear me okay?
Yes, we can.
I'm Deborah Moon. I'm an assistant professor in the School of Social Work at the University of Pittsburgh. So I also attended the same the FRAME workshop pre-conference institute. I was primarily interested in I was familiar with the literature around FRAME and adaptation fidelity, but I wanted to utilize a FRAME possibly proactively to plan collaboratively with stakeholders to plan for adaptation, systematic adaptation in my K project. So I, had some questions about, although like frame was like originally developed to, document and report, like how can we use it to proactively plan for adaptation with the stakeholders? So I got some answers around that. I got also some tips around how to write about that in my grant proposal. So that was something that I found helpful. Other than that, there was another session that I attended around the presenter called Science of Engagement. The presenter was Dr. Villa Lobos from NIH. I think she's at NCI. So she basically did the review of all implementation science literature around how people define and operationalize engagement. So she focused on engaging stakeholders and how can we measure that construct within a project, and then what would be the ways to quantify the effects of engagement, how can we draw some connections between engagement and outcomes. So I thought, the way that she framed it as engagement science was interesting, particularly because I actually presented a poster around the construct, like one of the Fidelity construct that's called like participant responsiveness. It's really about engagement. So I actually got interested in that construct. So I did the scoping review of literature, how people operationalize that concept. So I was like, starting to think maybe, we can think of that engagement at multiple levels. So my work really focuses on, looking at engagement of individual, like service participant, how they see the level of engagement. And then I kind of frame it as a participant responsiveness that, that's like I looking at behavioral, attitudinal, and relational. But then she was looking at engagement, not just individual, like client level, but engagement of stakeholders, engagement like organizations and community. So, we might be able to look at engagement at multiple levels, service, like individual service level, but also like a larger kind of cooperation, collaboration. So I thought that was kind of worth kind of further investigating. So I thought, yeah, that was one thing that really stood out to me.
Thank you. Yeah, that was super. Particularly the point about not just documenting, I think, adaptations, but using those to proactively plan. It's a good one. And even I think I see some more work thinking about kind of guiding iterative adaptations going forward too. So that was very super helpful. Thank you for sharing that. Tonya is next.
Hello, everyone. I'm Tanya Van Deense. I'm from UNC Chapel Hill, and sounds like I'm in good company because my takeaways are right on point, I think, with the other folks here. So I was thinking along the lines of the first plenary and the co-design conversation, the adaptation conversation there, and then later, I think this was on the last day in the morning, a session by Monica Yales Perez was talking about co-creation there as well. And so similarly to the last speaker just now, I was kind of shopping around also for some kind of, perhaps using frame as more process for planning for a study that we're doing involving a lot of engagement at the local level, but basically creating or tailoring implementation strategies for our probation and mental health intervention. So that's what I was shopping for when I was at the meetings last week. So, but largely takeaways around co-design and co-creation. Thanks.
Thank you. Yeah, as several people have commented, and particularly one, I think the opening keynote by Mary Dixon Woods was a lot about that too. But I think so much activity in the field around co-design, co-creation, different definitions of that and what people mean. And I think this notion about maybe what are central, if we can, core issues or components there versus kind of what is different. And I think maybe thinking about what do we get about each of the approaches, and then also just to circle back to Greg's comment, to me, this notion about that's not just an initial thing that you do right away, but the critical importance of going going forward and having that throughout. Kara, I think you're next.
Yeah, I was able to attend a lot of different types of sessions, and I think something that really stood out to me was the idea of the co-creation and co-design, but also adapting the implementation strategy ahead of adapting the intervention. And I thought that that was really interesting, especially in a few of the different sessions that I attended, and looking at the adaptation and the design for implementation process rather than only looking to adapt the intervention itself. So I thought that that was incredibly interesting and something I'd like to learn more about.
Good. Yeah, and that notion you mentioned about the sequence, it's interesting, adapting the implementation strategy first is interesting. I guess to say, usually I think about that probably overly linearly about that. You think about the context, then you think about what is the evidence-based intervention, and then how can we design a strategy to fit that. But that is an interesting perspective. Again, so much that we could follow up on here. I'm gonna keep going through the people that haven't had a chance to speak first, and then I'll come back to both other people that want to follow up on these threads, as well as see about some general discussion here. But thank you so much for all of these points. I think you're definitely drawn out. So this is so rich, and it's really cool to see what this aspect of our field, how it's moving and thriving, and where it's going. David Goodrich.
Hi there. Can you hear me?
Yes, we can.
I apologize. My immune system decided to adapt to all the social contact I had, and I just acquired this wonderful virus that's making me stronger, if not weaker, temporarily. But it was great to be at the session, and Russ, I have to say the debate that they had on generalizability and external validity kind of brought me back to some of the debates you used to have with the folks from NHLBI. So that was a positive flashback.
You said positive, not PTSD.
No, I really enjoy hearing different perspectives. It was spicy. It was a little different than like the debates you used to have with Dr. Kaufman, but I honestly had trouble getting into some of the individual sessions because I was having such wonderful conversations in the hall. And one session I really wanted to go into was on de-implementation on Tuesday, because folks at our Pittsburgh BA and the University of Pittsburgh we formed a group on de-implementation. And I almost think of that as adaptation of implementation science, since you're kind of adapting to come up with new theory and overcome unique challenges of getting people to stop implementing. And one of my New Year's resolutions for this group is one of my colleagues has submitted he's resubmitted a grant on de-implementation that uses PRISM and REAIM, and it would really be nice to share that with this group because we're looking to see what iterative adaptations we need to make. And it's my regret that I didn't get to learn more in the focus sessions, but I have to say that the poster sessions were really great, and I learned a lot from. It seems like a lot of the AFT type topics were in poster sessions, and I'm glad that I went through and slowly just met with people. So hats off to all those people who had posters that couldn't get into a session, because I felt like the poster quality was really excellent this year.
Yeah, good observation. I agree. There was a lot of richness there. Two things. If you'd like to follow up offline about the PRISM and iterative use or whatever, I'd be glad to. Won't take the group's time to do that today. But I'm wondering, you mentioned the de-implementation session. Is there anybody going out of order, just unmute yourself if anybody was able to go to the de-implementation session, and if there are any takeaways from that anybody had? Not hearing any. Okay, Mayuko.
Hi, can you hear me?
Yes, we can.
Great. My name is Mayuko Ito Fukunaga. I'm a pulmonologist at the University of Massachusetts Chan Medical School. This is my third time to attend the DNI meeting and the first time to present my poster. So I was very excited about that. I attended a session about the MOST and also the implementation science research project in the critical care setting. And that session about the critical care setting implementation science research project was very interesting because one of the speaker was talking about his project, and when he was planning to do the final adjustment before he go to the study, there was a new evidence-based practice coming out, so he have to make adjustment before he go to the real trial. So I thought that was very interesting, and we face that a lot. I think when we submit the grant, maybe that was most evidence-based practice, but when we actually receive the funding and try to do the study, situation may be changing because evidence-based practice evolve. So I thought that was a very interesting discussion. So I also enjoy the debate about the context and generalizability. I also enjoy a lot of people from the different countries are participating in this conference. And I met implementation scientists from Japan, which is my home country, and learn what kind of activities going on in field of implementation science in Japan. And it seems like Japanese government are start talking about implementation science approach in healthcare systems and the public health. So I'm curious to learn how Japan going to use implementation science in their healthcare policy and system as well. So I think those are my take-home message from the conference.
Great, great. Yeah, and it is very interesting, I think, thinking of the huge differences in context in the healthcare system, or non-system that some different countries have, things around that to think about the context there. The issue you raised about the intervention, kind of changing, even though you have an evidence-based one before you actually start the larger trial, is interesting. And I think I've seen more use at the NIH of this mechanism, this UG3, UH3 mechanism, where the first year or two is devoted to, before you actually do the trial, working with your partners and things like that to really kind of fine tune the intervention and implementation strategies. And I find that, at least in concept, a really kind of neat thing to kind of recognize. It doesn't often work just to take things totally off the shelf and do them exactly as they were before. I think is interesting. But thank you. Greg, so you have your hand up again.
Just a few observations. So I was struck by the number of first meeting attendees, and I think it speaks to where we are as a field as well. So we have a lot of folks who are relatively new to implementation science, and we see that in submissions to our journals to implementation science and implementation science communications. And so we're anxiously awaiting for those large trials, whether they're quasi-experimental or randomized or even observational studies. Yeah, I think it's good that the field is maturing, but we also have a lot of enthusiasm for the field, which I'm really excited about. I wanted to mention that the session in the chat, people were talking about Corey Bradley's talk, which I was at. That session was making visible inequities embedded with implementation science theories, models, and frameworks. Corey's, as usual, incredibly inspiring and thought-provoking presentation. If you haven't got a chance to hear Corey speak, I highly recommend that. But I was a little disappointed that there was little talk about how we integrate those issues of power, equity, structural racism into theories, models, and frameworks. because there's a lot of opportunity for that. And I put it in the chat, a nice article that illustrates especially kind of a really deep dive into issues of power in implementation within the EPIS framework, not from my group, from some other folks. So I think we could do more work there. I was also glad to see more international work. I met some folks also from Japan, Dr. Shimazu, Saito, and Sasaki. It was very exciting to have conversations with them, but there's also a lot more work in LMICs, and I wanted to just give a shout out to the National Cancer Institute. Has a current RFA on implementation science in cancer control in low and middle income countries. And I and a team from Nigeria, we were lucky enough to have a UO1 project funded under the first RFA that came out. So NCI is really kind of pushing that and creating new, it's the opportunity to create new collaborations. You know, a lot of our talk in our project is about how we are tracking adaptations. So we're, you know, using periodic reflections, we're monitoring adaptations as we go. But we also tried in the first year of the project to do tailoring and adaptation by engaging communities. And we're in all six regions of the country, but bringing together partners and collaborators to do as much tailoring and adaptation prior to actually starting the trial as we could. And I know that that won't eliminate adaptations that are going to occur during the study, but we thought that taking that approach would be helpful, and it also engages the different folks at different in the different regions of the country.
Great, thank you, thank you. Just to come back to one of the comments you made there about integrating more equity and particularly issues like power or more structural issue into our theories, models, and frameworks, implementation science and things. It's a interesting, I think, a real important issue. And I did enjoy, I think that came in part on one of the panels that were there, that Julia Moore, I see we have Julia on today. And don't know if you're able to talk, Julia, but I was interested in that in your session. And also in particular, one of the comments that you made about trying to increase the accessibility of our theories, models, and frameworks even more. But I appreciated that. And if you can, Julia, maybe you'd just like to share your key takeaways from the meeting.
Yes, hello everyone. So I would say the thing that I was most pleasantly surprised with at the meeting, obviously coming from my extremely biased view as someone who focuses on the implementation practice end, is that there were a lot of people who wanted to know about the practical practice of using theories, models, and frameworks, sometimes for research purposes, and a lot of times for informing actual implementation efforts. And so that was really exciting to see, because I think that that is a shift in this conference. And I think that this was reflective of a lot of people's comments about there was a lot of new people to the field. And I think that our field is shifting and growing. And that means meeting people where they're at. And I think a huge part of that, and I know, Russ, you and I have talked about, like, how can we make things really practical and really useful for people while retaining the actual science that backs what is embedded inside of all of these things that we are trying to use, noting that sometimes we don't actually have science to back some of the components of what we're doing. So it's kind of this mixed bag of, like, sometimes there is science backing things, and sometimes like a random panel of people suggested adding things to a list. And like, is that really the same thing? But I think that I have been excited by the number of people even reaching out to us to say, hey, how do you make things really practical for people? Because a lot of people seem to want to use what we have to offer. And so I think let's meet them where they're at, because there's greater demand than we have supply today. So those are my kind of quick thoughts.
Thank you. Yeah, I definitely noticed that too. And that notion of the right interface between science, when we have science or whatever, with the pragmatic, practical thing, I think really is important to write on there. Many ways different, but I think related, the same notion for this whole group or whatever, this balance between quote fidelity, however you think about that, and adaptation and things. So, but thank you much. Again, I really did enjoy your panel, and also I thought it was great to see Carl May and some of his observations there. Gila, you should feel pretty good here with the positive comments and things that people have made about the meeting, but what are your reflections?
Well, to be fair, Russ, I can't take any credit. I mean, it's all of your great work that is what made the meeting great. But I just wanted to, first of all, say thank you to everybody on the call for like this input, because it is helpful for us as a planning committee moving forward, thinking about what should we keep, and definitely keeping the poster walks, the coffee chats. It's great to hear that is valuable to folks. And I raised my hand to your call because I wanted to share a take-home message that I took home, which was actually, I mean, echoing the great stuff that people said in those sessions I was able to attend. I agree with everything I've heard so far. But the one thing that I just wanted to add was a comment that Julia Moore made in that panel on the point that we'll do these readiness assessments and then we'll often go to where people are ready. And just that I found to be like a call to action that has been ringing in my head ever since the conference. And I think to the points that people have raised about power and equity and how do we address that in our methods and how do we tackle that challenge, I think, starting there. And yeah, I'm not sure what to say beyond, it was a powerful message and I appreciated it. And it's great to see that this was like a thread throughout the conference.
Thank you. Yeah, good reflection by both you and Julia. Yes, my initial thought about that, and maybe we want to start there in a moment. I wanted to share just one reflection or thought I had, and then maybe that might be a good general topic for us to open up here further. But just one initial reaction that I had there is I also agree with that, and particularly from, key focus on who's at the table and who isn't. And also, if you will, just to be a bit provocative and maybe, overly critical, the cherry picking that I think we often do in our research, because the focus on, getting results and things. So we start with, where's the easiest, who's the most resources, what's the most stable organization, that sort of thing. So I think that's a great point, and it kind of relates maybe to capacity building and working before we jump right in, working with partners there. But I appreciate those reflections. I want to share just one myself from one of the pre-conference sessions organized by Andy Eisman that I had a chance to participate in around costing and cost. And I was also pleased to see pretty strong attendance and interest at that session. And the reason why is related to this. In my experience, cost is one of the key drivers around adaptation, and particularly when you start thinking either initially about whether there's going to be any adoption at all, if you look at what the cost, and there are different types of cost, and then certainly for sustainment. I think that often drives when particularly funding goes away and things like that. I think that's one of the key determinants. And then one of the things that came up, it wasn't a formal part of the conference or the workshop, but I thought this notion of maybe doing some type of modeling ahead of thinking about cost along with feasibility that you're going to do an intervention. And that could be all the way from formal systems dynamic modeling, particularly participatory, to what somebody called just back of the envelope costing, just to see, just pass the sniff test about could that ever be feasible to be done at all, or if so, how is the program going to need to be adapted? So that's one possibility. Let's see, not that, but to focus up on this issue that Julia and Gila raised here about picking a session, or where do you work with that? But first, let's see. I see Kelly has her hand up. So why don't we go to you, Kelly?
Well, yeah, I was just gonna kind of react to what Gila and Julia raised. And at the conference when Julia was, when she was talking about, Julia, you're here, so I can talk to you in the first person. When you were talking about implementation readiness and the real, like taking on the challenges of working in spaces where people might not be completely ready to adopt an evidence-based practice, it all makes me think about a big part of my work is funded through our state contracts in the community mental health system at the Bureau of Behavioral Health in New Hampshire. And also I partner with people who are funded through HRSA grants, and they're not science, that's not research. But it's working in our state contract. We're working to implement coordinated specialty care for first episode psychosis in all of our 10 community mental health centers, including rural places that just don't have the bandwidth to stand up a full coordinated specialty care team. And we do training, technical assistance, implementation support. And that work is not research, but we're using, because several of us are implementation science trained or oriented, we're using approaches that may be evidence-based to support these teams to implement. But I have to be honest, that work doesn't count as part of my I get critiqued too from whoever is in charge of potentially promoting me from an associate professor and beyond, that's fine, we're doing that, but a lot of my work needs to be NIH funded. And I personally, that's not, I'm not as driven by the academic promotions, but I think it got me thinking about the diversity of the projects we take on and how you can do some of the work that Julia was talking about if you're open to different sources of funding that aren't just NIH focused, and you partner with your states or you partner with the federal government and other non-research oriented grants to get that work done. So it just got me thinking a lot about diversifying funding and what you're taking on, and if it's just NIH research, and at what point in your career you do that, and so forth. So I think that's just to add to the conversation about how you get that where you get opportunity to do that practical work and working with teams that might not be ready for implementation, maybe through other sources of funding and opportunities.
Yeah, thank you. And that is a broader discussion too, I think, when we think about this, what are the criteria that, I know this happens a lot, including study sections, about how much evidence is needed, before you do an intervention. And I would like to add my favorite soapbox is evidence on what do we need? And often I think that evidence we have is a pretty narrow bandwidth about things. I see David has his hand up, but we've been having Rich starting this around this issue that Julia and Gila have both raised. So David, I'd like to check and see with you, is your comment on this issue or something else?
Well, I think it is. I think it's kind of related to cost and power, and just a real quick observation that the one thing I didn't really hear anyone complaining about, especially in the plenary or larger group sessions, was just the trend in healthcare for consolidation. That, things have been very consolidated, vertically integrated is the term I think they use in business school. And a lot of private equity that frankly is not accountable or interested in evidence-based medicine as much as profit.
Yeah.
And I just wonder how much that's going to be a pressure on our health system. We hear complaints from the national health system in Britain and to a certain extent our Canadian neighbors, but more and more it seems like it's a challenge above and beyond what we've done before. And I wonder how much that's going to change the focus of D&I research.
Yeah. Good observation. Sobering. But yeah, I agree. I will know one other thing that I didn't see at this meeting, but as you know, in the VA, Todd Wagner, has done a number of great things, but that directs the health economics group nationally for the VA, but has focused a lot on budget impact analysis. And I think that's another interesting area, thinking ahead and maybe both projecting what that's going to be as well as assessing it there. I do want to come back though. We've been talking a lot here about, Julia, the issue that you raised both at the meeting and then today, but see if you have any further thoughts or things you'd like to react to on the discussion about this notion of where do we decide to work.
Yeah, I mean, I think it's one, I think it's fascinating how resonant that comment has been with people. Because I've heard that, I've gotten a few emails from people and stuff as well. I think it leads to this really important question, which is, if sites aren't ready, what can we do to support them to be ready? And what does the science say are the best ways to do that? And I think that, I've talked to Greg, I was just talking to Greg at the conference about helping leadership build up leadership skills, because sometimes that's part of the problem. I think that there's a huge workforce problem that almost everyone is experiencing in all sites that you're working with. And in fact, I would argue that right now, very few sites are, quote, ready at this moment in time, because everyone is so burnt out and short-staffed and kind of experienced post-COVID trauma at an organizational level, that maybe we holistically need to figure out how to shift to thinking about pre-implementation strategies for everyone to better meet them where they're at. And so that's where we've been thinking a lot. So that's thought one. And thought two is, we've been trying to think a lot about system readiness, not just organizational readiness. And I think that there's a huge opportunity to figure out what that looks like.
Thank you. That's great. I like the phrase. I hadn't heard it too, about post-COVID trauma on the part of that. But then this notion, is great about the pre-implementation strategies there with and particularly system perspective, I think is great. We're coming up close to the top of the hour, and I'm afraid I am going to need to go a couple other to lead another meeting in just a couple minutes today. But I wanted to do two things. One, I want to see from Kara, who's helping me monitor things. And by the way, Borsika sends her note or condolences that she couldn't make it today. She really wanted to, but just had other demands that she had to attend to today. But I really do want to thank all of you for your great observations here. And I'm going to turn to Kara in just a minute, but I'll also ask you to put in the chat here, if you would, reflecting on our reflections here, two things. One, if there are particular suggestions about other sessions. I've made a couple notes that this group would like to do forward. What would you like to hear about going forward? There's so much exciting work in this space. And then second, if you had any suggestions for themes, or other structural things for the group planning the meeting next year, please put those in, because there's a number of people here that are intimately involved in that. That would be great. But Kara, was there any last thing that we came up in the chat that we didn't get a chance to talk about?
I'm trying to go through it, but I think that there's a lot of really great comments to different speakers on today's meeting. I don't necessarily see particular questions, but I know that the chat has been very busy this morning, so if you guys want to take a look at it, but I don't see anything on my end. I apologize if I've missed one.
Okay, that's great. And we do save the chat, so if any of you want to follow up on that or whatever, Kara, you could contact Kara to see about that. And then just to circle back to where we started, again, if you'd like to volunteer either yourselves for something follow up here or another topic that you'd recommend going forward. But I think we will stop and give you at least 2 minutes for bathroom break before your next meeting. And just wanted to thank everybody for this great discussion and for what you've done for the field, and wish you all the best for the holidays. So take care, everybody.